Hello, I'm Dr. Vinod Vijan, 67th year, young, a senior interventional cardiologist, currently now in Pune, in PCMC, Pimple Saudagar, and I've started my second venture called UniQare Hospital and Research Center. UniQare, it is QARE, not to mistake with CARE, which many people write. There's a similar hospital by that name. So we call it, to make it more emphatic, quality about care. So Q about C. So we have started this hospital just recently. A senior cardiologist, now 38 years in practice, and now in this YouTube, I shall be giving you information about the Department of Non-Invasive Cardiology at our newly opened hospital, UniQare at Pimple Saudagar in Pimpri Chinchwad, Pune. This is the past, present and future Vision Hospital, where I'd worked for 38 years and yet going strong. And our second venture is UniQare at Pune, which is our present and future. So I will be talking about this beautiful, it's a very lavish, over 1 acre plot and can have eventually 250 beds. Currently we have started with 75, and it is a multi super specialty hospital with all facilities, and besides cardiology in general medicine, surgery, orthopedics, but our key focus remains in cardiology and critical care, being a cardiologist ourselves, myself and my son, who is also a DM card. So these are the departments which we are gradually building up, and it is open to all qualified doctors who would wish to come and associate along with us. Fortunately for us, because of our past records, we have been given an accreditation by the International Society of Cardiovascular Ultrasound. There are only few in the country, and by none other than the founder of this society, and under whom I have been trained, and he is also called as the father of echocardiography, and we have named this department on his name as the Naveen Chinanda Institute of Excellence in Non-Invasive Cardiology. And also when we started the hospital, we had the blessings of the Union Minister of State for Health, Dr. Bharti Pawar, who was to come, but because of G20 was engaged on that day for particular events. This is the machine which we have. We have found that most of the machines were Vivid T8, but we opted for the one which was just introduced last year by GE, and this is the one which is powered by artificial intelligence. The difference with this Vivid T9 that it has a matrix probe unlike the other, which makes the screening and resolution remarkably, and it has other features in T9 which I shall show you with cases. Besides these automated functions and lots of technical details which we shall show it by cases. This was a patient who was breathless and had done an echo which was reported to be normal as ejection fraction is concerned, and when he came to us, we requested that we should repeat it, and on repeating we found that the ejection fraction was not markedly reduced, but look at the global longitudinal strain. This was seriously compromised. So today only asking an echo and reporting normal ejection fraction is outdated, and we may miss certain cases. This is a classic cherry on top, a case of amyloidosis, which is a serious disorder that was causing breathlessness, and if not treated in time, investigated, is sure going to lead to mortality, and as it becomes very severe, there is no treatment other than heart transplantation. And here is another case which was told to conserve, which was mitral stenosis with incompetence. The mitral incompetence was not severe, but yet when we went and saw the effective orifice, we said that this is severe and then something has to be done. And again, the new concept nowadays is we do not look at the ejection fraction itself. The new concept, even in rheumatic disorders, is not to just look at the wall but ignore the muscle. Here we found that the global longitudinal strain had started reducing.
And once this starts reducing, even if you do a successful operation or surgery of wall replacement, the results are not going to be good because the heart is already weak. This is another condition where we do the longitudinal strain of the atria also, which is possible in Vivid T9. So this is called as a pre-pump. This is the earliest marker of heart failure, and this was not possible in the previous editions. And if everything is normal, even if the left ventricular GLS is normal, the pre-pump GLS is reduced, normally should be 33 to 35. We know that there is going to be a problem. This patient may develop atrial fibrillation, which is the commonest cause of stroke. Similarly, we also do this global longitudinal strain for the right ventricle, and this should be always more than 20 to 22. And if it is again impaired, we know that there is going to be a failure on the right side of the heart, even though the pumping may be normal. And also it was the proud privilege from Pimple Sodagar to be invited as a faculty in the Bangladesh Echo Conference. Of course, it was digital, and being the only foreign faculty for that country, and where we conducted a lot of cases, presentations on that for that country. We also have the stress test, in which is again by General Electric, and then this also has got a standard protocol with which the accuracy is very high. This is an example where we always don't do the plain stress test, but we do the stress echo. You can see here that after when you do the exercise and the certain areas of the heart, the contractility reduces. This is in the circumflex territory area, as you can see, that this is known as the posterior basal, we used to call the inferior lateral wall, or in the old times we used to call the posterior wall, and here the basal inferior wall in two-chamber view. They are, and we know that even though ECG hardly shows any significant changes, but there is wall motion abnormality, and more important, the stress GLS also reduces, thereby giving an indication that this is not going to be a negative, but it's definitely, this is the proof on all accounts that there is an area which is under threat and he would require an angiography. So this changed the whole diagnosis. Now again, we always do, we used to have contrast. Unfortunately, the contrast availability all over the country has been stopped by one of the leading manufacturer. Yet without contrast also, we do the stress echo, and we can see how the heart behaves at rest, how it behaves at the peak of exercise, and how it behaves in the recovery phase. This, coupled with ECG changes, increases the accuracy and reporting of a stress test from 60% in a male and 50% only in a female to almost 78 to 80% with the stress echo. And if you include the stress GLS, there is no data, but it may go up to 85 to 90%. And if your normal stress echo, then definitely a significant coronary artery disease is ruled out. This is a case very interesting. He had come from Uttarakhand in the regional government hospital, and he was told that the right side is all become big and it is in failure. Again, he had come to Noida, he got a second echo done, and then he had even come to at Pune hospital where a transesophageal was done to rule out whether there is a hole in the heart or a ASD, because he had 2 episodes of stroke or a paralysis from which he had nearly recovered. And then when we did the echo, we said, oh, this is a different condition. This is called as Epstein's anomaly of the heart, in which the tricuspid wall since birth has been displaced upwards. So these even congenital anomalies can be picked up with experience. And besides this, we have been conducting free workshops on mannequins for many doctors in the past, and even it was a privilege to be an examiner for Maharashtra University of Health Sciences, and here conducting the exam at Sir H.N. Reliance Foundation. This was the pre-COVID era, and we also were privileged to get an award in United States by the American Association of Cardiologists of Indian origin for our humble contribution to cardiology in India. To the left is the father of echocardiography, where I was trained more than quarter of a century ago, and it is for whom we have great regards, and he has come to my center more than 6 times and is yet the leading figure with maximum number of publications in the field of echocardiography. And also it has been a proud privilege now to be the organizing chairman of our national conference, and I would invite all doctors, all physicians to come and attend, because echocardiography is just like a stethoscope and everyone should know. Even when we started with the first color Doppler at 1992 at Nasik, you can see Dr. Nitu Manke and others had come, and we were again blessed by the visit of the Union Home Minister, the State for Health, Shri Jayaprakash Ji Nadda, and even other ministers when they came to inaugurate our very high-end 3D color Doppler machines. Now, coming outside echocardiography, we also have another sonography machine, which is the Logic P9 XD Clear, which the radiologists perform, the qualified one, and this has got lots and lots of features to do sonography examination. We have a CT scan also at UniQare, and all these are being upgraded further, and this is all to say that we are truly a multi-speciality hospital and growing fast. And to conclude, this is a hospital which is basically for the patients by the doctors, and we work in unison as a team. There is no single leader. Everyone here is comes and joins as equal, and a beautiful relationship is our journey from me to we. We need all each other's contribution equally, and that is how we are going to improve the standard of healthcare of our region, as we have been doing it in Nasik and also now in PCMC. I would invite you all to come and visit us, and we hope that we can offer the best of services. I would end my talk for YouTube here.